Generation Sick: The Power, Politics, and Propaganda Behind America's Health Crisis. Written by Dr. Vic Naumov. Copyright 2016. All rights reserved. Before we begin this journey together, and it is a journey, one that's going to ask you to look at your health, your country, and maybe even your own beliefs a little differently, there are a few things Dr. Naumov wants you to know. This is a disclaimer, and it matters, so listen closely. Consult a medical doctor or other licensed medical professional if you suffer from any medical conditions. This publication presents only the author's opinions, which are based on his knowledge, experiences, and beliefs. This book and its contents do not cure, prevent, diagnose, or treat any disease or condition. The purpose of this book is educational, for research, and for entertainment. The information contained within it is for informational purposes only. The author, the publisher, and everybody involved with the publication, distribution, or sale of this book assume no responsibility. Now, with that said, Dr. Naumov opens this book with a quote, one written over 200 years ago by a man who signed the Declaration of Independence. Listen to how relevant his words still are today. Unless we put medical freedom into the Constitution, the time will come when medicine will organize an undercover dictatorship. To restrict the art of healing to one class of men and deny equal privilege to others will be to constitute the Bastille of medical science. All such laws are un-American and despotic and have no place in a republic. The Constitution of this republic should make special privilege for medical freedom as well as religious freedom. That was Benjamin Rush, MD, a founding father of this country and a man who saw, even then, what could happen if healing became a monopoly instead of a right. Keep that quote in your mind. It's going to echo through everything you're about to hear. This book's foreword was written by Vincent Crowe, advocate for healthcare freedom, liberty, and individual prosperity. He opens with a quote of his own. "I am not here to change the world. I am here to change myself and to protect my children at all costs, so that they have the right to grow and live longer and better than I do, all in accordance with natural law." That's Vincent Crowe. Here's Vincent, in his own words. They claim that health is wealth. If that's a fact, shouldn't the wealthiest country in the world be the healthiest? The United States of America generates per capita the most wealth in the world. So I ask you, why does it rank dead last when it comes to health out of the top 11 countries in the world? After Dr. Vic Naumov asked me to write the foreword for Generation Sick, I began my research, and I came across an article published June 16, 2014, authored by Mary Mahon and Beth Ann Fox. The title reads, U.S. Health System Ranks Last Among 11 Countries on Measures of Access, Equality, Quality, Efficiency, and Healthy Lives. Wow, I was surprised, because I, like you, was conditioned to believe that the United States of America was the wealthiest country and had the greatest healthcare system in the world. I guess I was seriously misled, because the data tells a different story. Since the United States also has the most expensive healthcare system in the world, I accepted the idea that the most expensive automatically meant the best. What I learned was, that's absolutely not the case, not by a long shot. The countries in the study were Australia, Canada, France, Germany, the Netherlands, New Zealand, Norway, Sweden, Switzerland, and the United Kingdom. Here's what the report found about the United States. On healthy lives, the US does poorly, ranking last on infant mortality and on deaths that were potentially preventable with timely access to effective healthcare. Second to last on healthy life expectancy at age 60. On access to care, people in the US have the hardest time affording the healthcare they need. The US ranks last on every single measure of cost-related access. More than one-third, 37%, of US adults reported foregoing a recommended test, treatment, or follow-up care because of cost.
On healthcare quality,
The US ranks in the middle. On effective care and patient-centered care, it actually ranks near the top, third and fourth of 11 countries. But it does not perform as well providing safe or coordinated care.
on efficiency,
The US ranks last. Due to low marks on the time and dollars spent dealing with insurance administration, lack of communication among healthcare providers, and duplicative medical testing. 40% of US adults who visited an emergency room said they could have been treated by a regular doctor had one been available. That's more than double the rate in the UK, just 16%.
and on equity,
The US ranks last. About 4 in 10 adults with below-average incomes in the US reported a medical problem but didn't visit a doctor in the past year because of cost, compared with less than 1 in 10 in the UK, Sweden, Canada, and Norway. There were also large gaps in how long US adults waited for specialist, emergency, and after-hours care compared to higher-income adults. The fact that the United States ranked dead last in these categories seriously concerns me, not just for myself, but for my family, my community, and my country. We as Americans deserve to be healthy.
but before we act on emotion,
A step back is necessary. It's only when we understand the principle of cause and effect that we can begin to clearly see we didn't get here by accident. I'd speculate we got here by design. In business and in politics, nothing happens by accident. Everything in the public domain happens by design, regardless of what things look like on the surface. Healthcare is big business in the United States, and as you can see, it's also the most expensive in the world. And yet, even with all that money injected into the system, the results fall short. People are getting sicker and sicker, while their pain and suffering continues to fund a system that seems to have been a failure since its inception in 1913 by John D. Rockefeller, Sr.
I've always wanted to know
Why? Why the richest country in the world had one of the least successful healthcare systems? As I kept searching for answers, my research led me to a book by Eustace Mullins titled Murder by Injection. That book gave me the documented answers I was looking for. I finally began to understand that the allopathic medical system was set up by John D. Rockefeller Sr., not to help, heal, or cure any disease, but to create profit through lifelong customers driven by pain, suffering, and the continued consumption of poisonous drugs.
on page 348,
The last page, Mullins wrote, America became the greatest and most productive nation in the world because we had the healthiest citizens in the world. When the Rockefeller Syndicate began its takeover of our medical profession in 1910, our citizens went into a sharp decline. Today, we suffer from a host of debilitating ailments, both mental and physical, nearly all of which can be traced directly to the operations of the chemical and drug monopoly, and which poses the greatest threat to our continued existence as a nation. Unite now to restore our national health. The result will be the restoration of our national pride, the resumption of our role as inventors and producers of the modern world, and the custodian of the world's hopes and dreams of the liberty of freedom.
Powerful words.
From a brilliant man who understood that health is wealth.
As a result of John D. Rockefeller's efforts,
Today, we are still sick, still tired, and dead last in healthcare out of the top 11 countries. For the sake of the American people and future generations, it should not be this way. In my opinion, it's a disgrace and a testament to the failure of both the allopathic healthcare system and the hidden hand of the Rockefeller Foundation that controls it. Education, awareness, and action. These are the three essentials necessary to bring about real change if our goal as a society is to be truly healthy. The next generation depends on us.
what kind of legacy do we want to leave for our children?
Do we really want to raise another generation sick? I sure don't. What are we going to do today to bring about the change we want to see tomorrow? It's important to understand. Knowing and not doing means you don't know anything at all.
Our children deserve better.
Let me correct myself. Our children deserve the best we have to offer. They are our future, and they deserve the opportunity to live their lives to their fullest potential.
Dr. Vic Naumov wrote this
Informative, explosive book so that you will finally learn the facts. How we got here, who gave us our current allopathic medical system, who controls it, and what the ultimate agenda is. After reading this book, ignorance is no longer an excuse, and sickness does not have to be looked upon as a normal way of life. This book is the game changer you've been looking for, and it holds within it the potential to restore the power to the people. The time to rise, get informed, and take action is now. We all deserve the opportunity to be healthy.
Yours in Health.
Vincent Crowe, advocate for healthcare freedom, liberty, and individual prosperity. And now, Dr. Vic Naumov, in his own words. This is the introduction. World events do not occur by accident. They are made to happen, whether it is to do with national issues or commerce, and most of them are staged and managed by those who hold the purse strings. That's Dennis Healey, UK Secretary of State for Defence from 1964 to 1970, and Chancellor of the Exchequer from 1974 to 1979. As I look at the current state of affairs within the United States of America and the rest of the world, I constantly find myself thinking that nothing is what it appears to be. The deeper I dig into a topic, the more questions seem to rise to the surface. There never seem to be any clear answers.
When I embarked upon this project,
My primary goal was to expose the control system behind the convoluted series of healthcare reforms that have been promoted over the past several decades. The healthcare plan proposed by Hillary Clinton back in 1993, for all its claims to respond to a groundswell from the people, was the epitome of top-down reform. The driving force behind what eventually was enacted under the name Obamacare is a group comprised of members of the economic and social elites, and among the primary intended beneficiaries of the program are the large insurance companies and drug conglomerates. The army of the uninsured, many of whose members will undoubtedly benefit to some degree, are merely pawns in a larger game. A game whose purpose is to complete the takeover of the healthcare system by large corporations and so-called charitable trusts, a process initiated and greatly advanced by John D. Rockefeller Sr. His efforts to organize the medical education system and to promote a drug-centered, allopathic system of healthcare were the opening salvo in a century-long battle to control a sixth of the American economy. While it's certainly true that President Obama was a strong advocate and the public face of healthcare reform, Dr. Naumov's research into the facts and the history surrounding the slow and tortuous path to Obamacare led him to argue that Barack Obama was neither the original architect nor the primary author of the policy itself. In Dr. Naumov's view, Obama served as the public face, the messenger, for a reform package shaped well before his presidency by other interests within what he calls the control system. Given that Obama was young, charismatic, and well-spoken, he was, in Dr. Naumov's analysis, an effective spokesperson for the effort. He appealed to the young and the old, the rich and the poor. His historic status as the first African-American president enabled him to reach across racial, socio-economic, and gender lines, helping his signature program of healthcare reform gain a hearing and ultimately passage. Obama's success in achieving passage of Obamacare in the face of powerful opposition, not least from a very large number of the American people, led many admiring media commentators to acclaim him as, quote, the most consequential president since Franklin D. Roosevelt. His detractors, with equal fervency, derided his plan as a threat to the capitalist system and the American way of life. Dr. Naumov's central argument is this, that Barack Obama lent his name and his political capital to the Affordable Care Act, commonly known as Obamacare, but that the substance of the policy had much deeper roots. He traces the Obamacare framework back to the plan spearheaded by Hillary Clinton in the early 1990s, which was itself influenced by an earlier Jimmy Carter-era proposal, which in turn drew on ideas circulating around the Nixon administration. The first large-scale trial of this general approach to healthcare reform was enacted in Massachusetts under Governor Mitt Romney, and, Dr. Naumov notes, the intellectual underpinning for the mix of managed competition, price controls, and insurance regulations we know as Obamacare traces back to a study by the Heritage Foundation, which proposed managed competition as an alternative to a single-payer, socialized medicine system. The end result is a law that only a think tank or a billionaire healthcare tycoon could love. Obamacare's multi-level reforms have certainly succeeded at reducing the number of uninsured. But the cost-benefit analysis is a complicated matter, one that will keep tens of thousands of think tank experts and lobbyists employed as it spawns numerous investigations, pro and con PR campaigns, and, not to put too fine a point on it, existential threats to the Republic and to special interests of all kinds. All of this back and forth only serves to mask the true identities and motivations of the dark, moneyed forces who have assumed control of the healthcare system in America. In this book, I will unmask some of these bad actors and their supposedly good intentions. Along the way, I will present my vision of natural healthcare alternatives. As a doctor of chiropractic, I understand that we must nurture nature, not destroy it. The human body is naturally adaptable, and our goal as healthcare providers should be to help people maximize their innate adaptability factor so that they can live happy, healthy, and productive lives. I call this book Generation Sick because I think too many people, especially young people, are taking the easy way out. Participation in sports is way down in many communities to the detriment of our health and well-being. Part of this is due to the disturbing phenomenon of sports superstars who inspire disgust among the public through actions including murder, rape, road rage, heavy drinking at strip clubs, gambling on their own teams, abusing animals, and numerous other crimes and improprieties. I am outraged by the widespread adoption of performance-enhancing drugs and energy drinks among so-called elite athletes, whose status as role models has in some well-publicized cases been compromised by their own admitted or sanctioned conduct. Alex Rodriguez, for instance, was suspended for the entire 2014 season by Major League Baseball for performance-enhancing drug use, a suspension he ultimately did not appeal. Michael Phelps was suspended from competition and lost sponsorships following a 2014 DUI arrest, his second such arrest. These are athletes who, by their own admission or by official sanction, fell short of the standard expected of role models and whose conduct reverberates among our youth. The abuse of steroids and other so-called performance-enhancing drugs is a major stain on our national honor. People are also taking the easy way out in many other critical areas of life. Junk food binges, which were not so long ago the butt of jokes, have now morphed into steady diets of junk food. Some school lunch programs now feature pizza as many as 3 times a week, with the other 2 days devoted to chicken nuggets and hot dogs. Even would-be health food nuts have fallen prey to the chemical food industry's promotion of toxic crap as healthful and nutritious. Most people don't realize that diet soda only serves to fatten them up, and that the creamy Italian or balsamic vinegar salad dressing they pour on their genetically modified vegetables and bacon bits contains more salt and sugar than nearly anything else they'd be likely to eat. All this exercise deprivation and junk food translates into poor performance at work and in the bedroom. People who take the lazy way out by eating TV dinners in front of a large-screen TV are usually not averse to cutting corners at work either. American manufacturing know-how and craftsmanship is now so diminished that we've mostly taken a back seat to China and Mexico and Malaysia. Researchers spend more time on Wikipedia than at the library. Migrant workers from Mexico and Central America pick our fruits and vegetables, clean our houses and hotels, drive our delivery trucks and passenger vehicles, and do the lion's share of the labor that would require the use of chainsaws, hammers, screwdrivers, shovels, pickaxes, or stone-cutting tools. Instead of doing an honest day's work, most Americans are involved in organized profit-making activities such as real estate sales, financial sales, law, and medical billing. The result is an ever-widening ripple of bubbles bursting, time spent on longer and longer lines, and bankruptcies, many of them caused by credit card financing of botched or unnecessary operations and life-saving procedures that didn't save anybody's life. The country is now trillions of dollars in debt, and the chief preoccupation of our policymakers is to figure out new ways to expand the entitlement system that takes care of military veterans, senior citizens, school children, the poor, the disabled, and especially the rich, who contribute so generously to our corrupt politicians and are overwhelmingly the chief beneficiaries of government largesse. Landlords suck up HUD money. Walmart is the final destination of most EBT money, and Obamacare is a cash cow, not only for the doctors, nurses, and EMT technicians who see patients, but also for the financial conglomerates and hedge funds that own and control the large hospitals and pharmaceutical companies that receive the vast bulk of the proceeds from the hugely expensive treatment of the chronic diseases generated by our unhealthy lifestyle. It should be clear by now that I am deeply opposed to the current policy of making the healthcare system an adjunct of the financial system. In my opinion, The prevalence of drugs in our society is an unmitigated evil. While I acknowledge that there are times when drug treatment may appear less painful or more fast-acting than known alternatives, I found that I'm mostly able to get along just fine without recourse to toxic chemicals. I do not believe that the vast increase in easy availability of prescription drugs and other controlled substances, which we can expect as a result of the dubious alliance of healthcare reformers and medical research institutes dominated by drug money, will result in greater health and happiness among the American population. There will be many who criticize my solutions as too simplistic, too extreme, or too outmoded. I'll acknowledge that the centerpiece of my healthcare recommendations, the life-saving diet promulgated by Dr. Sebi, is controversial for legitimate reasons. Nonetheless, I'm sticking with the Sebi diet because it works for me and it works for my family. I fully realize I'm swimming against the tide when I criticize practices that have become so ingrained in our society. But the other direction is full of sharks, and I really don't want to swim with them. This book is not intended to tell you what to think about the control system, their secrets, or their purposes. It takes no position. It has no agenda. The information and opinions contained within simply serve as a platform for exposing facts you may not have known. My purpose is to give you another perspective on the history of the process that led to so-called healthcare reform in America, and to propose an alternative vision based on the time-tested methods of natural healing. I hope you'll find this discussion thought-provoking, and that the ideas I raise will generate some serious conversations among your friends and family. You may make your own decisions and choose for yourself what positions to take on the many healthcare issues at hand. But I hope you'll emerge with an understanding that deeper forces are involved than seems apparent at first glance. That these forces are, for all intents and purposes, unstoppable, and that Obamacare is as much, if not more, about plowing profits to the control system as it is about improving the health of the American people. The late actor and comedian Robin Williams, 1951 to 2014, said it best in the movie The Dead Poets Society. Just when you think you know something, you must look at it a different way. In one of the great ironies of our time, Williams, who personified the ideals of energy, compassion, and personal integrity in so many of his wonderful TV and screen performances, also struggled in his private life with some of the very pressures Dr. Naumov writes about in this book. He was a wonderful, giving, intelligent, witty, and loving man. Earlier in his life, Williams had spoken openly, in his own interviews, about his past struggles with alcohol and substance use, struggles that were widely reported at the time and that he himself discussed publicly. More than a year after his death by suicide, further revelations came out about the medical reality behind it. According to his widow's public statements and the autopsy findings, Williams had been suffering from Lewy body dementia, a disease that can cause exactly the kind of depression, anxiety, and cognitive decline that tragically contributed to his death. In addition to early markers consistent with Parkinson's disease, if we are to make any progress at all in improving the health of our society, we need to redouble our efforts to reduce the omnipresence of over-the-counter, prescription, and illegal drugs in our national experience. It avails us nothing if all our progress in increasing life expectancy is undermined by drugs that drive people to murder, suicide, and depression. You can have all the Obamacare benefits you want, but if the medical system is geared toward abetting the self-destructive and murderous tendencies of our young men and women, we are doomed as a people. This book is a unique amalgam of entertainment, instruction, and political commentary, sometimes verging into satire. I hope you enjoy it as much as I've enjoyed writing it, and I hope it contributes in some way to your quest to live a better and more active life.
Thanks for listening.
That's it for episode 1 of Generation Sick.
If anything in this episode hit you,
If it made you angry or hopeful or made you look at your own health a little differently, that's exactly the point. This book was written to wake people up, and the conversation is just getting started.
in the next episode,
We go deeper into the system itself. Who built it, who profits from it, and what it's really costing you. If you want to be there when it drops, hit subscribe and turn on notifications so you don't miss it. And if this episode meant something to you, do me a favor. Like it and share it with someone who needs to hear it. That's how we restore the power to the people, one listener at a time. I'm narrating Generation Sick by Dr. Vic Naumov. I'll see you in episode 2.